Welcome to the deep dive. Today, we're tackling your request to decode hepatitis B lab values. You've sent over some medical information, and we're going to break it all down.
It's important to understand this virus can have some serious consequences for your liver.
Definitely. So to start, what's the first lab value we should discuss to help understand if someone even has Hep B?
Well, the most basic test is the HBsAg. This stands for hepatitis B surface antigen.
Okay.
It's the primary indicator of an active infection.
So if that one comes back positive, what does it actually mean for the person getting those results?
It means the hepatitis B virus is currently in their system, and we need to investigate further. We don't yet know if it's an acute or chronic infection at this point.
So it's like a first alarm bell, but not the whole story.
Exactly. There are other lab values that help us fill in the details. One of those is the presence of antibodies. For example, if the anti-HBs or hepatitis B surface antibody is present, that's actually a positive sign.
How so? Aren't antibodies usually a sign that you're fighting something off?
They are. But in this case, a positive anti-HBs means you've either recovered from a past infection or have been successfully vaccinated.
Oh,
It's like your body's built-in defense force against HBV.
so that's one to celebrate then. I see we also have something called anti-HBC, the hepatitis B core antibody. Is this another one to hope is positive?
Anti-HBC is a bit more complex. It simply tells us that you've encountered HBV at some point in your life. It doesn't necessarily mean you're currently infected.
Ah, so it could be a past infection that's completely cleared up.
Precisely. Think of it as a record in your immune system's archive. Hey, I've seen this guy before.
That's a helpful way to look at it. Now, there's another antibody listed here, IgM anti-HBC. How is that one different?
IgM anti-HBC is what we call an early responder. It shows up early in a recent infection, like a fresh recruit battling the virus.
Right.
If this one is positive, it usually means you're in the acute phase of hepatitis B.
So that's helpful for doctors to figure out the timeline of the infection, right? To know if it's a brand new encounter with the virus or something that's been going on for a while.
Exactly. It helps us piece together the story of the infection.
Okay, we've covered a few antibodies, but there's still a couple more lab values on this list. We have HBAg and anti-HBB. What do those tell us?
HBAg stands for hepatitis B antigen. This one indicates the virus is actively replicating and highly infectious. We use it as a measure of how much the virus is potentially spreading within the body.
So if HBAg is high, that's a cause for concern, right? It means the virus is really active and could potentially be transmitted to others.
Yes, it's something we monitor closely. On the other hand, anti-HBB, the hepatitis B antibody, is actually a good sign.
Okay, so back to antibodies being the good guys. What does a positive anti-HBB tell us?
It usually means the infection is less active and potentially resolving. It's a sign the body is gaining control of the situation.
That makes sense. It's like the immune system is starting to win the battle.
That's a good way to think about it. Now, the last key lab value we need to talk about is HBV DNA.
I'm guessing this one directly measures the amount of virus present.
That's right. It gives us what's known as the viral load. A high viral load means active replication and infectivity, while a low or undetectable viral load suggests the infection is less active or even resolved.
So this is a crucial piece of information for doctors when determining how to manage the infection. It sounds like we've got a pretty solid understanding of the major players in these lab reports.
We do. And knowing what each of these values means is the first step in understanding the bigger picture of hepatitis B. But it's how these values interact with each other that's truly fascinating.
Okay, I'm intrigued. So how do we use these lab values to differentiate between acute and chronic hepatitis B?
That's where things get really interesting. Let's start by looking at acute hepatitis B.
Perfect. So in the case of an acute infection, what would we typically see in the lab results?
With acute HBV, you'd almost always see a positive HBsAg right off the bat, confirming an active infection. And, as we discussed, you'd likely see a positive IgM anti-HBC as well. Remember, that's the antibody that shows up early in the game.
So those two are the most obvious indicators that someone is in the initial stages of a hepatitis B infection. What about HBAg? Would that also be positive in an acute case?
Yes, you'd expect a positive HBAg as well, indicating active viral replication and high infectivity. Importantly, you wouldn't see a positive anti-HBs yet.
Okay.
Body hasn't had enough time to develop those protective antibodies.
Okay, so it's a snapshot of the early stages of the infection. What about chronic hepatitis B? How did the lab values shift in a chronic case?
The key difference with chronic HBV is that HBsAg remains positive for more than 6 months.
Right.
This means the infection hasn't been cleared by the immune system and has become a long-term condition.
So chronic hepatitis B is essentially a long-term battle with the virus. What about the other markers like anti-HBC and HBAG in chronic cases? Do those change?
You typically see a negative IgM anti-HBC in chronic cases simply because the initial acute phase has passed. However, you'd have a positive IgG anti-HBC, signifying past exposure to the virus. Now, HBAG is where things get a little more nuanced. It could be positive or negative depending on how active the virus is at that moment.
Ah, so with chronic HDV, those HbA levels can fluctuate. That makes monitoring over time even more important, right?
Absolutely. We need to keep a close eye on how the virus is behaving to make the best treatment decisions.
Now, what about someone who's recovered from a hepatitis B infection? What would their lab work look like?
If someone has successfully resolved an HBV infection, we'd see a negative HBHV. This means the virus is no longer actively replicating. You'd also see a positive IgG anti-HBC as a reminder of that past infection.
And what about anti-HBs? Would that be positive too in a recovered case?
Yes, absolutely. A positive anti-HBs would indicate their immune system has successfully cleared the virus and developed those protective antibodies. They're essentially immune to hepatitis B now.
So they're protected even if they encounter the virus again.
Exactly. It's the best case scenario.
Yeah.
Now let's talk about those who've been vaccinated against hepatitis B.
Right. Vaccination is such a powerful tool. So what would we expect to see in the lab results of a vaccinated individual?
Ideally, we'd see a negative HBsAg and a negative anti-HBC, indicating they haven't been infected with the virus. The crucial finding, however, would be a positive anti-HBs. That's how we know the vaccine did its job in triggering the production of those protective antibodies.
So the presence of those antibodies is like proof that the vaccine was effective in building immunity.
Exactly. It's like having a shield against future infection.
It's incredible how much information these lab values can reveal about a person's history with hepatitis B. It's like having a window into the body's interaction with this virus.
It is fascinating, isn't it? And understanding these values is crucial for making informed decisions about diagnosis, monitoring, and treatment.
I can only imagine. But I'm also wondering, how do these lab values inform real-life medical decisions? It's one thing to know what the results mean, but it's another to understand how they're actually applied in clinical settings.
You're absolutely right, and that's what we're going to delve into next. Let's take what we've learned about these lab values and see how they translate into real-world scenarios. So let's say a patient comes in with symptoms like fatigue, jaundice, and abdominal pain. The doctor suspects hepatitis B and orders a panel of those blood tests we've been discussing.
Okay.
If the results show a positive HBsAg and a positive IgM anti-HBC, that paints a pretty clear picture.
It points to a recent acute infection, right? Sort of like catching it in the act.
Exactly. And knowing it's an acute infection helps guide the next steps.
Okay.
For example, the doctor would advise the patient on things like rest, hydration, and most importantly, monitoring for any potential complications.
So in the case of acute hepatitis B, it's more about managing symptoms and letting the body fight it off.
Yes, most cases of acute Hep B resolve on their own. But sometimes the infection doesn't go away, and that's when it becomes chronic hepatitis B.
And I imagine the lab values would look quite different in a chronic case.
The most significant difference is that HBsAg remains positive for more than 6 months. This tells us the infection hasn't cleared naturally and requires long-term management.
Right.
It's also when we start to think about antiviral medications.
Because chronic hepatitis B can lead to more serious complications down the road if left untreated.
Exactly. Chronic inflammation can eventually lead to scarring of the liver, known as cirrhosis, and even increase the risk of liver cancer.
That sounds pretty serious. So how do those lab values we discussed guide treatment decisions for chronic Hep B?
Well, remember HBV DNA. That tells us the viral load, which is essentially how much of the virus is circulating in the blood. If the HBV DNA level is high,
Right.
it suggests the virus is replicating quickly and potentially causing more liver damage.
So a high viral load would be a red flag that more aggressive treatment is needed.
In many cases, yes. That's when doctors would likely recommend antiviral therapy to suppress the virus and protect the liver.
Can you tell us a bit more about how these antiviral medications actually work?
There are several types of antiviral medications available, and they all work in slightly different ways. Some block the virus from entering liver cells, while others interfere with its ability to replicate. The ultimate goal is to reduce the viral load as much as possible, ideally to undetectable levels.
That makes sense. Lowering the viral load takes the pressure off the liver and gives it a chance to heal, right?
Yes, That's the idea. We want to minimize the damage and prevent long-term complications.
So we've talked about acute versus chronic hepatitis B, but what about those who are fortunate enough to have been vaccinated? How do we know the vaccine is actually doing its job?
That's where our friend anti-HBs comes back into play. If you're vaccinated, we expect to see a positive anti-HBs test.
Uh-huh.
That's how we know the vaccine successfully triggered your immune system to create those protective antibodies.
So it's like a confirmation that you're shielded from the virus. It seems pretty straightforward. But I'm curious, what if someone tests positive for anti-HBC, meaning they had a past infection, but also has a positive anti-HBs?
That's a great question. It means they've not only recovered from a past hepatitis B infection, but have also developed long-term immunity, either naturally or through vaccination.
So their immune system has a double layer of protection.
You could say that. They've encountered the virus, fought it off, and are prepared if it ever tries to return.
I'm seeing how these lab values really do tell a story about a person's journey with hepatitis B,
Yeah,
but I imagine there are still individual nuances that doctors have to consider.
absolutely. Lab tests are incredibly valuable tools, but they're just one piece of the puzzle. It's essential to consider the patient's overall health, their individual risk factors, and their personal preferences when making treatment decisions.
So it's not just about looking at numbers on a page. It's about understanding the person behind those numbers.
Exactly. For instance, someone might have a positive HB-Ag, but a relatively low HBV DNA level. This could suggest a phase of lower infectivity, but it doesn't mean they're in the clear. We still need to monitor them carefully and consider their individual circumstances.
So it's really important to have an open dialogue with your doctor to understand the nuances of your specific case.
Absolutely. Don't be afraid to ask questions and advocate for your health. The more informed you are, the better equipped you'll be to navigate the complexities of hepatitis B.
That's such an important message. And speaking of staying informed, I know research on hepatitis B is constantly evolving. What are some of the latest developments in this field?
That's a great segue because one area of research that's particularly exciting is the development of new antiviral drugs.
Okay.
We're always looking for ways to improve the effectiveness of treatments and reduce side effects.
That's encouraging. So while we've made significant progress in understanding and managing hepatitis B, there's still a lot to discover and much hope for the future.
Absolutely. And one area I think will be particularly impactful in the coming years is the focus on a functional cure.
A functional cure, what exactly does that mean?
It means suppressing the virus to such low levels that it's essentially undetectable and no longer causing any harm,
Okay.
even if traces of the virus remain in the body.
So essentially aiming for a state where the virus is no longer a threat to the person's health.
Exactly. And while a complete eradication of the virus might be challenging, a functional cure is a very realistic goal that could transform the lives of millions living with chronic Hep B.
It's fascinating to think about the potential breakthroughs that could be just around the corner. But in the meantime, knowing our status, understanding these lab values, and having open communication with our doctors are crucial for effectively managing hepatitis B.
Couldn't agree more. And that brings us to a final thought-provoking point for our listeners today. We talked about anti-HBC being like a record in the immune system's archive.
Right.
What if scientists could use that record to develop even more effective treatments or a cure for hepatitis B?
So are they trying to enhance that immune memory that already exists?
Yes. One approach is therapeutic vaccination. It involves giving additional doses of a vaccine even after infection to try and stimulate a stronger and longer-lasting immune response.
Okay.
Another approach is to use drugs that specifically target and block certain proteins that the virus needs to survive.
It sounds like there's a lot of promising research in the works.
Yeah,
It must be encouraging for those living with chronic Hep B to know that scientists are working towards a cure.
absolutely. And in the meantime, knowledge and proactive healthcare are our best defenses.
I'm definitely seeing that. Knowing your status, understanding your lab values, and talking openly with your doctor are all key.
Couldn't agree more. So if there's one thing to take away from our deep dive today, it's this. Don't be afraid to ask questions, advocate for your health, and stay informed about the latest advancements in hepatitis B research.
Those are great takeaways. And I think we've shown that those lab values aren't just random numbers. They tell a fascinating story about your body's fight against HBV.
They really do. And understanding that story can empower you to take control of your health and make informed decisions about your care.
Well said. So until next time, keep diving deep.
You've been listening to the Learning Podcast, a production of metaNESTA. Remember, learning is a journey, One step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.